A ventricular peritoneal shunt, also known as a VP shunt, is a device that is placed in the brain to help disperse the brain fluid that builds up in the brain. A lot of times people develop hydrocephalus. Hydrocephalus is the buildup of spinal fluid in the brain cavity. When that spinal fluid gets built up in the brain cavity, it can cause a lot of issues by putting pressure on the brain, making the fluid build up in other places, approximately the spinal cord maybe. When it builds up on the spinal cord, it can ultimately start to tear and shred the spinal cord. When it tears and shreds the spinal cord, one could become paralyzed. VP shunts a lot of times are placed at birth. A lot of children are born with hydrocephalus. VP shunts can also be placed later in life if there's some kind of head trauma that develops, such as a car accident, anything along those lines, a traumatic brain injury. My name is Jennifer Honeyfort. I am currently enrolled in the Human Resource Program at Marion Technical College. I do have a VP shunt, and I have had a VP shunt for approximately 9 years now. Today I will give information on what a shunt is, what it helps, and the complications that could happen over time. A VP shunt, by definition, is a device that treats excess spinal fluid in the brain ventricles. The way they place a VP shunt, a burr hole is created in the skull, which means they drill a hole in your skull and they place tubing inside the brain ventricle. The tubing then goes outside the brain cavity, along the skull, and will go all the way down into your peritoneal cavity, more so your abdominal cavity. When the brain fluid comes out of your brain, your body absorbs it, and essentially you will urinate it out, just like any other fluid within your body. The device itself is magnetic. It has a magnetic spot on it so that it can be adjusted. The fluid can cause pressure in your brain. When the pressure in your brain happens, at that point you know you need to either speed up the flow or slow down the flow of how the spinal fluid is leaving your brain. I will show you a couple pictures so that you can better see the path that the tubing takes and the shunt takes. There's also different areas that a neurosurgeon may place the shunts. Some neurosurgeons, a lot of babies have their shunt, the magnetic piece, placed back here. Me in particular, I have mine up here. That's just where they had put it. It just depends on the injury and such like that. Here is the path of the shunt. So you can see that it starts up here. The valve itself is the magnetic piece, and then the tubing will go all the way down into your peritoneal cavity, which is your lower abdomen, more or less. I do have two other pictures. This image is a picture of my CT scan on where my shunt is placed. As you can see, my valve is placed up here. And then the next image will show where my tubing runs. Maybe. This is a side view of my CT scan. You can see my valve is right here, and the tubing runs along the side of my skull. So that is an image of mine. My tubing actually comes down here, goes down the side of my neck, down the front, and then it goes over to the side and down in here. I've had my shunt for approximately, like I said, 9 years. Some complications that may arise from it, some complications I'm experiencing now, that's how I know these are the complications. I get a lot of stabbing pain around my valve because I do get a lot of pressure in my head. When I get a lot of pressure in my head, I will call up the neurosurgeon. I will have it adjusted, to either speed or slow down the flow to help with that pressure in my head. A lot of neck pain is also associated with needing the shunt adjusted or needing the shunt replaced. Also, with the device being magnetic, with the valve being magnetic, if you have an MRI done, which MRIs are done to help with the placement of shunts, as long as a VP shunt series. A VP shunt series is a series of x-rays to see where the shunt is. But whenever you have an MRI done, whether it be on your knee, a shoulder, or just to check the placement of the shunts, you will need to get the shunt adjusted, because the magnetic field from the MRI machine will change the device itself, and that could cause a lot of issues. When VP shunts are placed in children at birth, the VP shunt is replaced more regularly because it needs to be replaced as the child grows. Just because the tubing at that point is not long enough, so they have to keep replacing the tubing in the individual for the fluid to drain properly. With me, I had my device placed when I was approximately 26 years old, 9 years ago, so I was told my shunt needed replaced every 7 to 10 years. The tubing on the shunt itself is just plastic tubing, so the tubing could get corroded, the tubing could get cracked, there's numerous things that could happen. And with the VP shunts, since it is a foreign object, the body itself could reject it. So it could cause infection as well, just because it is a foreign device within someone's body. Some people's bodies just don't handle things as well like that, and it also depends on how healthy or unhealthy they may be, and if they're really sick, that could also cause a lot of issues when placing a foreign object in the body. My shunt was placed because I suffered some brain trauma. I was in a bad car accident and developed a different medical condition. That medical condition caused me to have surgery. That surgeon messed up very badly and essentially caused the hydrocephalus in my brain, which is why I had to have multiple other brain surgeries as well as the shunt placements because of the mess up the doctor did. Basically, it was a traumatic brain injury, which is why I had to have mine placed. A lot of times when children are born with the hydrocephalus and do have to have the VP shunt placements, that is a lifelong thing. When I had spoke with my neurosurgeon, mine could not be or may not be a lifelong thing. It just depends on my brain ventricles and what my body does. Hydrocephalus develops when your brain ventricles enlarge. Your brain ventricles are a certain size, and when they are enlarged, they create excess spinal fluid. When that excess spinal fluid is created, that's what creates the buildup of the spinal fluid in your brain. It's just because there's so much more than what was anticipated, basically. Both of my left and right brain ventricle were enlarged. The right brain ventricle went back to normal size. My left brain ventricle has not, which is why I still have the VP shunt. If at some point my left brain ventricle is seen to go back to normal size, they will start to wean me off of the VP shunt. And if at that point I no longer am needing my shunt adjusted and it's where it would be at normally in a patient, if my spinal fluid flow is where it should be normally as it would be in a patient without a VP shunt, that is when they would remove it. In conclusion, a VP shunt can be scary, but it can also be interesting. I was extremely interested when I had mine. Clearly, I took pictures of my CT scan because I thought it was pretty neat, but I also do have a degree in the medical field, and I do like all things medical. I am intrigued by a lot of medical things. So if you are someone that is going into the medical field, knowing about hydrocephalus, knowing about VP shunts is something you may come across if you are going to work as a nurse or a doctor. It is a very good piece of advice to have knowledge on, just so you can better explain things to your patients. I know when I first was told about my brain injuries and my issues, one of the nurses there didn't exactly know what I was talking about, and I knew more about the situation than her, obviously because I researched it. So a lot of patients are going to research it. So something like this, it's not necessarily out of the ordinary or uncommon anymore, and it really is a good piece of advice to know when you're in the medical field.